Good morning, everyone. Today's topic, outbreak investigation. So, this outbreak investigation, what is the role of microbiology and how infectious disease specialist or microbiologist play a crucial role in it? Let us see it one by one. So, outbreak investigations usually consist of 13 steps. So, let us see them one by one. Let us first read them and try to understand them. So, first, you have to prepare for the fieldwork. Then, you have to recognize the outbreak and then prepare to investigate. Then verify the diagnosis and confirm that outbreak exists. Then construct a working case definition for that disease, for that outbreak. Find the cases systemically and record the information. Perform the descriptive epidemiology. Develop your hypothesis. Evaluate your hypothesis epidemiologically. Reconsider, refine, and reevaluate hypothesis if needed. Compare and reconcile with laboratory and environmental studies. Implement all the infection control measures, initiate or maintain the surveillance, and finally communicate your findings. So let us see them one by one. So prepare for field work. So first you have to actually confirm that actual outbreak is there or not. So first you have to confirm that cases have actually increased or not. So first confirm that increase in case has happened. It is not always necessary that you go through this, but the second step is important. Second step says us that you have to establish an existence of outbreak. Now, how we are going to do this? We will compare it with baseline data. So whatever disease frequency which is happening at the time of suspected outbreak, what is that disease frequency in other days? So what is their baseline rate at which it happens? If this is actually above than that, then you can suspect that okay, it is outbreak. And that's how you can also rule out the pseudo outbreaks which happens in certain cases. You can rule out clusters which very often confused with outbreaks. Second, you start immediate control measures if you establish an existence of outbreak. So that is by using standard precaution and appropriate transmission based precaution. That could be contact based, that could be aerosol or droplet precautions, whatever the disease may be and whatever transmission based precaution applied to that disease. Then notify and communicate mainly to all the healthcare workers involved in your infection control committee, hospital administrations, as well as laboratory and IDSP, especially if you are in India, which is a notifying authority. If you are outside India, whatever notifying authority in that country, you should also notify that. Then form outbreak control team, that is OCT, and especially main members of this committee should be the hospital administrator, clinicians, infection control team members, epidemiologist, microbiologist, and PRO. So this is about the second step. The third step is you have to verify the diagnosis and confirm that outbreak exists. Now, for that, you have to review all the clinical and lab data available, and then you have to summarize that. Finally, based on this, you will construct a working case definition. So you start with broad initially. So you suspect with if you have even a fewer typical clinical features, then you can suspect okay, this is a suspected case. Then you go with typical clinical features, it is a probable case, and if it is a lab verified, then and then you can stamp it as confirmed case. So whenever in an outbreak management, you will see a suspected case, a probable case, and a confirmed case. So you start with broad initially and gradually narrow it down. Then you have to find these cases systemically and record all the information. So for finding cases, we use active surveillance, passive surveillance. We will also follow up the confirmed cases which are admitted and discharged, and for which we know the outcome, and contact tracing. Now, active surveillance of all suspected cases, contacts through field visit should be done. Passive surveillance can be done by telephone or via email, and contact tracing can be done by asking patients about others with similar clinical features in their surroundings. Case report forms should include ID, demography, clinical features, risk factors, and reporter informations. line listing of cases should be done. Now, based on all this data that you have, you perform the descriptive epidemiology. Now, descriptive epidemiology means you define each case or this outbreak in context of time, place, and person. So that will give you an epidemic curve. The place will give you a spot map, and person information will give you the demographic details. So based on all available data, yeah, now you can develop an hypothesis why this outbreak has happened, what are the risk factors for it, and you can evaluate your hypothesis epidemiologically. So there are two studies which we commonly use. One is a case control study and another is retrospective cohort study, because we have to go back in time. Now, if you have a small well-defined population, then you should use retrospective cohort study, and which we will use either relative risk or risk ratio, that is basically attack rate in exposed divided by unexposed. If it is more than one, that means that factor is associated with the disease outbreak. If it is less than one, it is not associated. If you are using case control study, then it has to be a larger outbreak population where population is not defined, and here instead of relative risk ratio we are using odds ratio. For this studies and further details, you can check out our videos on biomedical research, which are available on our YouTube channel. Coming back to the next step, that is reconsider, refine, and reevaluate hypothesis if needed based on your finding. Compare and reconcile with laboratory and environmental studies, and then you implement the necessary infection control measure based on your hypothesis. So all standard and transmission based precautions as per the disease condition. Monitoring has to be done by all these control measure in form of audits, and you have to compare your infection control implementation with outbreak control. You have to initiate surveillance as well as maintain it. You have to communicate all the finding within hospital, and you have to make a final report preparation for oral briefing for local authorities, as well as you have to submit an written report, and you can also go for look back investigations. So if a question in exam asked about outbreak investigation and management or role of microbiology or infectious disease consultant in outbreak investigation, this much I think you should write in the exam. And I hope this is very self-explanatory. I have just given you an outline so that you can remember it easily. If you have any doubt, post in the comments of the video, and I will definitely try to answer it based off my capacity. Thank you very much. Subscribe to the channel, join the memberships for more such amazing videos.